Hey everyone, welcome back to Graft Academy. Today we're going to break down exactly how dentists rebuild bone for dental implants, step by step. If you've been told you don't have enough bone for an implant, you might be wondering how that bone can be replaced. The answer lies in one of the most fascinating parts of modern dentistry, bone regeneration. Let's start with what a bone graft really is. A bone graft is not just a piece of material that fills in an empty space. It's a biological framework that helps your body grow new, living bone. Dentists don't force your body to make bone, they simply give it the structure and support it needs to do what it already knows how to do. Here's how the process works. Step 1. Planning and imaging. Before anything begins, your dentist takes a 3D cone beam scan to measure exactly how much bone is missing, in width, height, and density. They plan the graft shape and volume needed to rebuild that area and determine which type of material will work best. For smaller defects, the graft may be done at the same time as implant placement. For larger areas, it's usually performed first, with the implant added once healing is complete. Step 2. Site preparation. During surgery, the area is gently opened to expose the bone. Any scar tissue, infection, or old graft material is removed so the surface is clean and ready. The goal is to create a fresh, healthy environment where new bone can attach. Step 3. Placing the graft material. This is where the rebuilding begins. Your dentist places bone graft material into the area where bone is missing. There are several types of materials that can be used. Autograft. Bone taken from your own body, often from the chin or jaw area. Allograft. Processed human donor bone. Xenograft. Bone from a bovine source that has been sterilized and purified. Alloplast. Synthetic bone substitutes made from materials like calcium phosphate. Each of these works as a scaffold, a structure that your body can grow new bone around. The graft doesn't become the final bone itself, it guides and supports your natural bone to grow in its place. Step 4. Protecting the graft. Once the graft material is placed, it's covered with a thin membrane, like a protective layer, to keep it stable and prevent soft tissue from growing into it. The gum tissue is then repositioned and sutured tightly over the area. This ensures that the graft stays still and undisturbed during the early healing phase. Step 5. Healing and regeneration. Over the next few weeks, your body sends new blood vessels and healing cells into the graft. Osteoblasts, the bone-building cells, attach to the graft particles and begin producing new bone matrix. Gradually, the graft material is replaced with your own living bone through a process called osseous regeneration. This phase takes several months but happens naturally and predictably. Step 6. Verification. Once healing time has passed, usually 3 to 6 months, your dentist takes a follow-up scan to verify that the graft has integrated. They'll look for solid, uniform bone and confirm that it's ready for an implant. If everything looks good, the implant can be placed directly into the newly formed bone. Step 7. Implant placement. When the implant goes in, it acts like a natural tooth root. It stimulates the bone every time you chew, which keeps it healthy and strong. At this point, your graft has completed its purpose. It's transformed into living bone that will now stay dense and functional for decades. Most patients are amazed at how comfortable the process actually is. Bone grafting is typically done under local anesthesia, and recovery is similar to a tooth extraction. Mild soreness and swelling for a few days, easily managed with medication and rest. Once healed, you'd never know the area had been rebuilt. It looks, feels, and functions like natural bone. To summarize, dentists rebuild bone for implants by placing a graft material that your body naturally converts into living bone. The process involves careful planning, stable placement, and months of guided healing. Once the bone matures, it provides a solid foundation for implants that can last a lifetime. Thanks to modern materials and techniques, rebuilding bone isn't just possible, it's predictable. Even patients who've been missing teeth for years can have strong, healthy bone again. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone preparing for implant treatment. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.